Statins and who should take them. Hi, I'm Jack Corbett, and today I'll be talking to you about statins. Statins are a type of drug designed to help lower levels of cholesterol in the blood. These drugs are important as high levels of cholesterol is potentially very dangerous, as it can lead to the hardening and narrowing of the arteries, resulting in cardiovascular diseases such as heart attacks and strokes. Statins are some of the safest and most studied medications available today, with various prescription brands available. How do they work? Statins slow the production of low-density lipoprotein cholesterol in the liver by acting as a competitive inhibitor for HMG-CoA reductase. The production of cholesterol takes multiple steps and chemical reactions, one of which is the formation of mevalonate from HMG-CoA. By acting as an inhibitor for HMG-CoA reductase, formation of mevalonate is reduced, preventing the production of more cholesterol. By slowing production of LDL, the cholesterol already in the blood can be taken and used to make bile, reducing overall blood cholesterol levels. Side effects. Many patients taking statins will experience very few to no side effects. However, some may still occur. So the most common side effects include headaches, dizziness, feeling sick, feeling tired or physically weak, digestive system issues, muscle pains, sleep problems, or low blood platelet counts, which can lead to clotting issues. The more uncommon side effects include being sick, memory issues, hair loss, pins and needles, the inflammation of the liver and/or pancreas, skin rashes and acne, or sexual problems. The rarest side effects include muscle weakness, the loss of sensation or tingling in the hands and feet, or tendon issues. The most common side effect found in statins is muscle pains, with 5 to 10% of patients being affected. These pains can be an issue as it may cause many individuals to stop taking their medication to prevent the pains. However, stopping their medication will result in higher cholesterol levels again, potentially leading to lethal cardiovascular diseases. It has also been found that grapefruit juice can affect simvastatin, which is the most commonly used statin. This will increase the levels of simvastatin in the blood, making side effects more likely. Who should take them? Statins are usually prescribed to individuals afflicted with a form of cardiovascular disease or the medical history that suggests the development of a cardiovascular disease. There are 4 main types of cardiovascular disease: coronary heart disease, where the blood supply to the heart is restricted; angina, where chest pains are caused by reduced blood flow to heart muscles; heart attacks, when the supply of blood to the heart is suddenly blocked; or the stroke, when supply of blood to the brain is blocked. Conditions which could indicate a high risk of developing a cardiovascular disease are diabetes, kidney disease, high blood pressure, or family members being afflicted by a cardiovascular disease. This shows a potential genetic condition. Patients can also be prescribed statins if already afflicted with a cardiovascular disease or a disease of the blood vessels. Statins are often taken in tablet form once a day, and usually once they start being taken, they must be continually used for life. Stopping will result in cholesterol returning to dangerously high levels within weeks. Statins are the most widely used medicine to lower cholesterol and have been shown to reduce cholesterol levels by 30% and up to 50% with higher dosages. Who shouldn't take them? There are multiple groups who have an increased risk of side effects: patients over 70, pregnant and breastfeeding women, patients with a history of liver disease, regular drinkers of large volumes of alcohol, patients with a history of muscle-related side effects, or patients with a family history of myopathy or rhabdomyolysis. Patients with an underactive thyroid, hypothyroidism, can lead to an increase in cholesterol levels, and so treatment for the thyroid will be complete first before statins are administered, as the thyroid treatment may reduce cholesterol levels to normal. Statins are also more likely to cause muscle damage in people with an underactive thyroid. Statins can also interact and react unpredictably with other medications. This can potentially increase the risk of serious side effects. Examples of these medications include some antibiotics and antifungals, HIV medications, and warfarin, a medication used to prevent blood clots. The most commonly used statins include atorvastatin with the brand name Lipitor, fluvastatin, also known as Lescol, pravastatin, also known as Lipostat, rosuvastatin, also known as Crestor, and simvastatin, known as Zocor. Simvastatin is the most commonly used statin worldwide. Alternatives to statins. Instead of using statins, lifestyle changes can be tried to reduce cholesterol, such as a healthy balanced diet, regular exercise, maintaining a healthy weight, limiting alcohol consumption, and stopping smoking. However, statins are usually offered after these changes have already been tried. In recent studies, it has been found that statins may increase the risk of developing type 2 diabetes. In the study, it was found that 1 in 17 patients not on statins developed diabetes, whereas 1 in 9 on statins did develop type 2 diabetes. Higher doses of statins have a higher risk, however those patients already have evidence of heart diseases and so require protection using statins. Evidence of previous studies have shown that for every case of diabetes caused by statins, 5 heart attacks or strokes have been prevented, and so the costs outweighing the benefits is down to the individual at risk. And so to recap, statins are drugs designed to lower cholesterol levels in the blood in order to prevent the onset of cardiovascular diseases. These drugs are widely available with many brands to choose from. Side effects are a possibility, however the majority of them are very rare, with the main worry being muscle pains. The decision to use statins is discussed with patients beforehand and often after alternative lifestyle changes have already been tried. As with all medications, contact your GP before taking action. And thank you very much for watching. Breaking news. As of today, the 19th of March, the first cholesterol-lowering pill in a decade has been approved by the NICE, the National Institute of Health and Care Excellence. Bempedoic acid can be used for patients who find statin side effects unbearable, or can be taken by people who are already taking statins whose cholesterol levels remain high. The product, marketed as Lamendo, lowers cholesterol by 28% when taken on its own, and up to 40% when combined with ezetimibe, the last drug to be approved 10 years ago. This shows that research is still being undertaken in this field, with new drugs still being found.